For new video updates, subscribe to the Nutspace YouTube channel. How do I politely, without hurting the sentiments of the parents, talk to them about a developmental problem in their child? This question comes from a recent experience I had when I met a 3-year-old child who I felt was struggling to speak. He was not even making eye contact with me. When I asked the mother about this, she told me that she was taking him for speech therapy classes. But I feel there is more to this than just a speech problem. Please advise.
Well, this is exactly what we try to do with parents in our clinic every day when they have a child who's 3 years old and is not speaking well enough and he doesn't have eye contact. The first point that I'd like you to understand is this is not about speech because everybody seems to be focused only on speech. And it is not either only about eye contact as well. Because I may be shy, I may be afraid of something, I may be anxious, and I may be avoiding eye contact. The point is this happening all the time? And is it happening meaningfully, meaninglessly? Is it the interaction normal? Is the interaction not normal? All these things matter. So, what matters is in the area of social communication, it starts off with the child establishing an interaction with people around him. This has to be a meaningful interaction. Interaction has to be to and fro, and it has to be related to a purpose. And you can start it off as early as 2 to 3 months of age. You find the child smiling with the mother. If he's smiling, looking at the mother, meaningfully enjoying the smile, and enjoys it when the mother smiles back, understands the meaning of the mother's smile, and then maybe smiles more in response, in interaction, then this is what meaningful social interaction and communication is all about. There are no words at 3 months of age, but look at the amount of social communication happening, and it's largely based on interaction and is non-verbal. But what is very important is not the width of the smile or the duration of the eye contact, it's the meaningfulness and the interaction and the purposefulness behind this entire interaction between two people who love each other. As the child grows older, he learns various other actions which again are meaningful and are used to interact purposefully with other people. For example, he learns to say or learns to make out that when the mother does this, this is a symbol for saying that I'm going away. But the child understands that after some time when he is going somewhere or when he sees a mother going somewhere, he may then indicate to her or express to her the same action. This is meaningful communication which is non-verbal. Could happen at as early as 7, 8, 9, 10 months. As it goes on ahead, when the child understands all these meaningful non-verbal communications, by the time the child is 1 year old, he understands to put a sound to these actions. So just like this action is a symbol for a purpose or a meaningful symbol, the sound bye bye is a substitute for this action. So the sound, which when it means something, it becomes a word. So when you say the child is speaking, it's not just the sound that he's producing. Even if he says mama, is he addressing it to the mama as a point of interaction with the mother? Is there a meaning behind it? He knows that only this is mama, and he doesn't say this to the auntie or the granny or the dad or the wall or the table or the roof. And is there a purpose behind calling out to mama? That is extremely important. It's not just the sound, because a word is a meaningful sound used interactively with meaning and purpose. At 1 year, the child would be able to say one meaningful word. By a year and a half or two, he'll be able to put two meaningful words together. Like, for example, mama look, or mama come, or mama take. By 2.5 years, the child should be able to put three-word sentences together. Mama water give, or mama water take. So the brain is understanding that there are three different words which have three different meanings, but when I put them together, I convey my own meaning to get the purpose that I want when I'm interacting with my mother. So this is what speech is about. Obviously, speech is not an independent milestone. Otherwise, all of us would have been speaking on the first day of our life. Speech has to be learned. Speech is something like walking, and unless you have learned to sit, you will not learn to stand. Unless you have practiced standing enough and have learned to stand very well, you will never be able to walk very well. So this is the entire way that we look at development of the social communication domain. Now, when you have this child who's 3 years old, who's not, according to you, speaking well enough and has poor eye contact, what I think you should ask the mother is this kind of poor eye contact only with one or two people, or is it generally the case? Is the child interactive enough all the time, like a 3 year old child? Does the child use words meaningfully all the time? And is he able to make a small sentence of 2 to 3 words meaningfully? More than that, is he able to understand a sentence of 2 3 words meaningfully? For example, come here and take this pen. There are two commands in this statement. Is the child at 3 years old able to understand sentences which are 2 3 command with 2 3 steps? Because if he is not understanding these commands, then it's unlikely that he'll be able to speak that way. Because it's first that we understand receptive communication, and only then are we able to express it or use it expressively. Now, if this child is not very good at verbal communication, you need to ask the mother whether the child is able to indicate by symbols, non-verbal communication. And if he is not understanding non-verbal communication, then you need to ask the mother whether the child is interactive enough or rather lost in his own world or more fixated on objects and toys. Now, if all the answer to all this is yes, then you probably have a child whose entire social communication domain is not very good. In which case, you need to tell the mother that by 3 years of age, most children will be able to pick this up in a stepwise manner. But this child probably does not seem to be picking up even the earlier stages. The better way is to ask the mother these questions and let her answer and think for herself. It's not a good idea just telling the mother, look, your child has a problem with this. It's not very fair and unlikely to carry much purchase. So when you ask the mother or the father or the parents these questions and let them find out for themselves what the answers are, then they probably realize that there's something much more than just a speech problem. So what we need to work on this child is not just the speech, but also the steps prior to development of speech. Just like you can never have a child walk unless he's able to stand well, which he can't do unless he's able to sit well. So there are steps that we need to take before we can even expect speech to come up. So you need to assess all this. Whoever you're taking your child to, that's great. Make sure you get a written report with a signature and a qualification of the person beneath it. And this is documented with you. Very often you'll find various people offering advice and various interventions, charge for it, of course, which is fine, but they would not even give you a report. I mean, why would you do that? You have to insist on a written documented report, because then it binds the professional to his or her professional commitment and his or her professional stand about what the child is having. These are not minor issues that can be just brushed away. Okay, come from tomorrow, we'll do some therapy and things will get better. You might be missing something much worse. And hence, it's very important to make the professional give you a written documented report, so at least we have something to compare going ahead a few months later, that here we were 3 months back, have we made substantial progress or no? If yes, then things are fine. If not, then we need to re-examine and re-look as to what's going on. So that's my advice to you.